So good morning everyone. I am Francine Quimpan. Today I will be providing you with a detailed insight into the integrated management of childhood illnesses. So this approach has been pivotal in improving child health worldwide. So let's delve into the definition, objectives, components, the color coding of IMCI for the evaluation, and I'll provide it also an example. So let's define what is IMCI. So IMCI is a holistic and evidence-based strategy designed by the World Health Organization and UNICEF to address the leading causes of morbidity and mortality in children under the age of 5. It aims to integrate the management of multiple childhood illnesses, emphasizing both preventive and curative measures. So there are four objectives of IMCI. First is the holistic care. IMCI seeks to provide holistic care by addressing not only individual illnesses but also considering the overall health and well being of the child. Second is the early recognition. So the primary objective is the early recognition of common childhood illnesses, allowing prompt and appropriate treatment. Third is the preventive measures. IMCI places a significant emphasis on preventive measures, including immunization, proper nutrition, and health education for caregivers. And lastly, the community involvement. So, another key goal is community involvement. IMCI encourages the active participation of communities in promoting child health and preventing illnesses. IMCI is comprised of three interrelated components. So first is the clinical guidelines. So standardized guidelines help healthcare providers in the identification and management of common childhood illnesses. So these guidelines are evidence-based and regularly updated. So second is the training of healthcare workers. To effectively implement IMCI, healthcare workers are trained to use the clinical guidelines, ensuring a uniform and high standard of care. And third is the health system strengthening. So IMCI is not only about healthcare delivery, but also about strengthening health systems to support the overall health infrastructure, ensuring sustainability. So IMCI utilizes a color-coded approach to classify illnesses and guide treatment. First is the green. So green indicate mild condition which require simple home care. Second is the yellow one. So it indicate situations that can be monitored on the health center, often with drugs, but that require definite follow-up. And third is the pink. So it signifies severe illnesses that necessitate urgent referral and immediate medical attention. So I provided one example of IMCI illnesses that are common in children. So mastoiditis. So acute mastoiditis is an infection of the mastoid bone behind the ear, often following untreated or inadequately treated ear infections. So in IMCI, it would typically be classified as a routine condition, requiring immediate referral. So, who's affected by mastoiditis? So, although anyone can get mastoiditis at any age, but children aged 2 and below are more likely to develop mastoiditis. So, now let's take a look at the chart. So, does the child have an ear problem? So, if yes, ask if there is a pain, air discharge, and if yes, for how long? And also look and feel for pus draining from the ear and tender swelling behind the ear. And let's classify the ear problem. If there is no pain and no pus seen draining from the ear, it classifies as a green, so no ear infection. So the treatment for this is assess and manage other ear conditions. So if there is pus is seen draining from the ear and discharge is reported for 14 days or more, classifies as yellow. So it means there is a chronic ear infection. So the treatment for this is dry the ear by wicking, treat with appropriate topical antibiotic ear drops for 14 days, and then follow up in 5 days. And then if there is a pus seen draining from the ear and discharge is reported for less than 14 days, and if there is an ear pain, also classifies as yellow. So the children has an acute ear infection. So the treatment for this is give an appropriate oral antibiotic for 8 days, and then give paracetamol for pain, dry the air by wicking, and follow up in 5 days. So if the patient has a tender swelling behind the ear, classifies as pink. So the children has a mastoiditis. So the treatment for this is give first dose of an appropriate antibiotic, IM, and give first dose of paracetamol for pain, and refer urgently to hospital. So my reaction on the articles that I've read is that reading about the childhood cases of acute mastoiditis makes me very concerned. So it's extremely concerning since this bacterial infection can result in serious clinical problems and potentially deadly outcomes. So the fact that it typically affects extremely young children, especially those under the age of 2, makes it even more concerning. So consider how susceptible these young children would be to such a severe mastoid bone infection. So it is clear how important it is to respond fast and use the appropriate antibiotics. It is important to administer timely and suitable antibiotic treatment in order to manage the sickness and prevent potentially fatal outcomes. It serves as a reminder of how important it is to be aware of these health issues, especially in light of the well being of young children. The need to treat acute mastitis as soon as possible emphasize how important it is to act quickly and how important antibiotics therapy in preventing children from suffering from the serious consequences of this infection.